medications today that your doctor ordered. Can you go ahead and tell me your name and date of birth? All right, perfect. Everything matches. Are you allergic to anything? No, okay.
For about a minute, and then offer them a
All right, your doctor has ordered 3 medications for you. The first one is enoxaparin, and then we're going to give you a hydrochlorothiazide tablet, and then we'll give you morphine. Are you in any pain? You're in some pain. Okay, what pain would you say level that's at? Okay, would you like to have your PRN morphine right now? Okay, I'll go ahead and give you that at the end then. So there were a few issues with the medication orders that the doctor gave, so I went ahead and called him. For the enoxaparin, the doctor had ordered that we would give it every 12 hours preoperatively. So I went ahead and confirmed with him because it's supposed to be given just one time, 12 hours preoperatively, and so he did say go ahead and just give it that one time instead of a standing order. And then another thing is the recommended dose is 40 milligrams, whereas he had recommended 30 milligrams, and the reason for this is that she is an elderly client, so we're going to give her just a little bit less. Then for the hydrochlorothiazide, there was another issue. It's supposed to be given with food, but she hadn't eaten yet at the time that I called the doctor, so he said to go ahead and have her eat a meal and then come back. So at this point, she's had a meal, and then we're going to give her this tablet, but after that she will be NPO by the doctor's orders before surgery. And then it was also supposed to be it's going to be a 12.5 milligram tablet, which we only had 25 milligram tablets in lab, and we did not have a pill splitter, so we will just pretend that that's a 12.5 milligram tablet. Then for morphine, on the order it did say to be given an IM, but no other medications can be given IM with the enoxaparin. So we will be giving that subcutaneously as well, and it's going to be given every 4 hours PRN, just as needed for pain. So I'm going to go ahead and begin. Alright, the first medication is enoxaparin, and so for that we do need to check a few things. It's an anticoagulant that she'll be given. Times that we would hold this medication would be if she was hypersensitive, had an allergic reaction to this drug in the past, or heparin, or if she's allergic to pork products. Another contraindication would be if she was having active bleeding at this time. She is not. Before we give it, it is really important to check her vital signs, which we've already checked, and those are all good. And then another is to go ahead and check her labs, draw blood for labs, especially a platelet count, and that's all good. As we're giving this medication, in the future we're going to remember to monitor that platelet count regularly. And then we're also going to teach her to go ahead and watch out for any bleeding or bruising that's unusual for her, especially like bleeding in the gums. And then to avoid aspirin or any type of NSAIDs, and then not to take any herbal remedies unless she's consulted a doctor first. Alright, so I'm going to go ahead and set this up. That's not handy.
And make sure you take any aspirin or any medication with aspirin.
Alright. So this is the enoxaparin. What's been ordered for her is the 30 milligrams. This bottle comes in a concentration of 100 milligrams for each milliliter. How does this happen to me all the time? Okay, that's just fine. So we're going to go ahead and draw up 0.3 milliliters of this medication. Go ahead and clean off the top. Okay, I hope that still works. Alright, and then we're going to draw back 0.3. And then insert the air into the bottle, and then let it draw out on its own.
And there's nothing in there about hypertension or.
Okay. If there are any air bubbles, we can go ahead and tap it. Get those out. And then we're going to go ahead and clean the site. This is subcutaneous injections. We're going to go ahead and do it on our stomach. And this is going to simulate what that would look like. And clean in circles. Alright. So I'm going to squeeze it just a bit and go in at almost a 90, but not completely. And then inject it slowly. 1 milliliter over 10 seconds is what's recommended. And then we're going to remove it in the same angle. Okay. And at this point, we would go ahead and dispose of this in the sharps container. And we normally wouldn't recap needles, but since I don't have a sharps container right here, I'm going to go ahead and do that so I don't stab myself. Alright, the next medication is her hydrochlorothiazide. So we're going to go over a few things that we would look at for that. She's going to be given 12.5 milligram oral tablet. A few things that we would be a contraindication for this would be if she was hypersensitive to any type of thiazides or if she had a renal disease. And then we would need to have caution if she had an electrolyte imbalance. So we've gone ahead and checked her blood pressure and that all looks good. And then we went ahead and checked her electrolyte levels, her glucose, her blood urea, nitrogen, and her creatinine. And those all look good. The glucose was a little bit elevated, but I did talk to the doctor about that and he said to go ahead and give it. So like I said before, you take this with food. And then some things that would be important to teach her is that she should wear sunblock if she's still taking this medication and she goes outside because it does increase sensitivity to the sun. And we would want to reassess her blood pressure after we gave this a little while afterwards. So we're going to go ahead and take the tablet. Again, this would normally be cut in half, but we just don't have a pill cutter. And then we're going to go ahead and give this to her with a little drink of water. So we would just go ahead and have her swallow this, drink some water to wash it down with. But obviously, since this is a mannequin, we can't do that. Alright, the final medication, she's going to be taking is morphine. She did go ahead and request it for her pain, and this is a PRN medication, and it's been at least 4 hours since her last dose. The doctor's ordered 5 milligrams. So we're going to go ahead and look at what we would need for that. One major thing that we need to look at is her level of alertness and as well as her respirations. If her respirations were below 12, then we would hold the medication and contact the doctor to see what he wanted us to do. Everything looks good for her. She's alert and her respirations are above 12. Another important thing is to go ahead and get a pain scale on 0 to 10, how much it hurts, just so that we can go ahead and reassess later to see if that helped. And then we're not going to use this solution if it's darker than a pale yellow, because that would mean that it's aged or it's been out in the sun. Some things that are important to teach her is that this may make her constipated, especially since she's also having a surgery. And she may feel dizzy or lightheaded or drowsy, but she's on bed rest right now, so she shouldn't be getting out of bed anyway, but just to go ahead and confirm with her, make sure that she doesn't get out of bed, has her call light. And if she has any difficulty breathing, to go ahead and tell a family member so that they can come get one of us. After surgery, she'll be using an incentive spirometer to kind of help with her breathing because, again, morphine may kind of reduce her breath. Alright, so for the morphine, the doctor's ordered 5 milligrams, and it comes in a concentration of 10 milligrams per milliliter. So that means we're going to go ahead and administer half of a milliliter. And one thing that I didn't do with the enoxaparin that would be really important to do is make sure that this is in date. It hasn't been expired. I'm going to go ahead and clean off the top. And one thing that I didn't mention, but that I've kind of been doing as I go along, is to go ahead and compare the label of the bottle and how much you draw up with what's been ordered. I've kind of been doing that along, but I didn't mention that. That's the third check. I'm gonna go ahead and clean the site. This is another subcutaneous injection. And then I'm gonna draw back the proper amount.
They might,
And before
I mean,
administering the medications, I've already
like for, like in a primary care clinic and someone
to make sure that
Okay. If there's any bubbles, we would go ahead and tap it to get this to the top. Make sure we still have the half mil.
they're just assuming
And then this site's already been cleaned, so we're gonna go ahead, inject it. And then at the same rate, 1 milliliter per 10 seconds.
I really
ordered to 10 or more meals, but is recommended to.
And then withdraw at the same angle.
safety.
And then again, we would not normally recap these, but since I don't have a sharps container right here, I'm gonna do that. So at this point, I would make sure that she's comfortable, has everything she needs, has her call light, and then that would be it. I would come in and reassess later.